Hi, I'm Dr. Daniel Peterson. I'm a neurosurgeon with Austin Brain and Spine in Austin, Texas. I became very interested in the problem of cervical range of motion and the challenges that we see with fusion very early on in my practice because we saw so many patients coming back for reoperations. And in fact, one patient that I can recall has had 4 individual cervical fusions. So when the information was coming out about the artificial disc, I became quite interested in it. This artificial disc is the Mobi-C. One of the wonderful things about this technology is that it's quite easy to implant. I have quite a bit of experience with a variety of artificial discs. I've looked at many of them, and some of them I just didn't feel comfortable putting in patients. Some of the designs didn't seem to be physiologically appropriate. Didn't seem to move the way the neck would move. What's wonderful about the artificial disc that doesn't have the keel, the LDR device, is that it's as simple as putting in the bone graft when you do a fusion. You don't have to machine or mill the bone. And I think that's really an interesting and beneficial aspect of this device. When we began talking with LDR, they instructed us that they were going to do a large clinical trial, and we became interested in participating in that. And one of the really interesting things about their approach is that they're looking at not just one level degenerative disc disease in the neck, not just one disc, but 2 discs or 2 adjacent level degenerative discs. So that's the first trial that was ever accomplished completely addressing 2-level artificial disc disease. And that's a very, very significant thing. Whenever I'm explaining to a patient the biomechanics of the cervical spine, I get out a model and I show it to them and I instruct them as to the anatomy. And it's very instructive to see how the different bones move across one another. So in flexion and extension, there's quite a bit of work that happens in the cervical spine. But the easiest analogy that I use when we talk about fusion is taking a chain with 7 links in it. And if you take a chain like that and you move it, you'll see movement at each one of those links. But if you weld 2 of those links together, you'll see movement above and below that weld. And if you weld 3 of those links together, you'll see even more stress on the joints above and below that 2-level weld. And so that's essentially what's happening in your neck when you get a fusion. With regards to the 2-level Mobi-C artificial disc, we were able to prove superiority. That means definitely better outcomes, significant reduction in reoperation rates compared to patients that have had 2-level fusions. So superiority in a trial like this is an astounding success. One of the exciting things that the LDR device offers patients is a new alternative. Rather than having to undergo a 2-level fusion, you can undergo a 2-level artificial disc, and there's no other device that's been approved that allows that capability. So this is really a disruptive and exciting opportunity for patients, and I think it's also a very exciting opportunity for physicians to sort of lead that technology and reduce some of the ongoing challenges that we see with fusion.